So starting off, today's meeting, make sure you sign in. I will be dropping in the chat the sign-in link quickly. Otherwise, you can go to the slides in the meeting email coming out tonight or tomorrow, and you can sign in there if you forget. We'll go through announcements and have the ECC Scribes rep talk to us, and then we'll dive right into our med student panel. And that will be pretty informal. You guys can unmute yourselves and ask questions. We have, I believe, 5 students with us today, and we'll go through their names and introductions here in a bit. And then next week, just a heads up, is a recorded interview with Dr. Khan. He's an oncologist, hematologist, and that recording will be coming out next Wednesday, so no live meeting. Let me get this link in here. Alrighty, that should be the sign-in link. So, like I said, next week is a recorded meeting. The following week, the first meeting in November, will be our Sustainability in Medicine meeting with a couple different speakers. That will be live, and then we have another physician interview the following week, and then the third week of November, we will hopefully be having a U of M admissions committee representative come in to talk about, from the perspective of the University of Minnesota Medical School, what they look for in their applicants, what you can do to better your application and stuff like that. We do have a date now for our suture clinic, and I got a couple of questions about this emailed to me in the last week. This will be done completely virtually, and we do have some materials that we will be getting and providing to all of the participants. You can still participate if you don't live near campus. You just will need to indicate that on the RSVP form, and we will find a way to get supplies to you. But we do have 30 spots available, and it should be from 5 p.m. to 7 p.m. the evening of November 19th. If you have interest, please fill out that RSVP form. And then, like I said, it should be about 2 hours. We'll go through all of the suturing and the trauma management and stuff like that with the doctors that will be guiding us through that. And then we also are awarding AMSA bucks for that event. So that is coming up. And then this is a fun little plug. If you're looking to make 20 quick dollars and you enjoy doing little exercises from your living room, one of the labs on campus reached out to us and wanted to share their PhD candidates are doing their dissertations. And one of them is a YouTube intervention based with physical activity. So you can email DJ, his email's at the bottom there, if you have any interest, and I attached the flyer with more information on what that consists of, but it's a 3-week trial, and I believe there's 2 exercises per week, each 30 minutes. So if that's something you're interested in, you can make a quick $1 or $2. And then for the Kaplan scholarships, I know we've talked about this previously. We have 5 Kaplan scholarships to give away this year, and they are worth the cost of one of the online Kaplan courses. So that can range from anywhere from $1,200 to $2,500. And your course is active essentially immediately upon earning the scholarship and will be active until December 31st of 2021. And this scholarship is aimed towards students that plan on taking their MCAT in the 2021 cycle. So keep that in mind if you plan on taking your MCAT in 2 years or 3 years because you're a younger student. Hold off on the application because this would expire before you'd actually want to study anyways. There is a short application linked on the slides, and I noticed a couple people were asking in the chat where all of the RSVP links and everything will be. When we send out our follow-up email tonight or tomorrow, the slides will be included, and all of the applications and RSVP links are hyperlinked on the slides and in the speaker notes. So you should be able to find them through there, and they'll be on our website as well. For this scholarship, you do have to be a national member since this is a scholarship provided to us with our national affiliation with Kaplan. If you have any specific questions about being on the fence about national membership, or you're not sure what that really means, or you're unsure of how to join, you can feel free to email me directly. I will add my email to the slides here for that information. And the application will open today, and it will close 3 weeks from today on the 11th. And then within the week after applications closing, we will announce the scholarship recipients. You should be emailed and receive your scholarship code by the 18th. And we're trying to get that out a little bit earlier this year in case we have members planning to take a January exam this year. So if you are interested in applying for this, you will have to provide a prospective MCAT date. And that bottom bullet point there, I have hyperlinked the AMCAS website with the MCAT 2021 schedule and registration link and everything. So if you are planning on taking your MCAT in the next year, that website can be used to find more information and help you prepare for the application. And I'm going to hand it over to ECC.
Hi, everyone. So my name's Bree. I'm the scribe recruitment specialist with ECC. And I actually work as a scribe as well. So I have kind of two roles. And so I'm just going to talk to you about being a medical scribe with ECC. Being a medical scribe, you basically, so you work one-on-one with NPs, PAs, MDs, DOs, and personally, I'm applying to medical school right now, and I found like in a lot of my secondaries, in the one interview I've had, it's been an essential tool to have that interaction with both physicians and NPs and PAs to kind of say, okay, this is why I want to be a physician, and this is the difference that I see. So it's pretty helpful in that sense because you get to see the medical decision making of all different types of providers. And you do the documentation for all patients. So you go into the room with them, they ask them questions, you know, when did your back pain start? When did, what makes it worse? What makes it better? Do you have other accompanying symptoms? Stuff like that. And you are in charge of creating a cohesive history saying, you know, Mary's back pain started this day, blah, 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 and creating that history. And then, you know, maybe they do imaging on this patient with back pain. They do a CT. They may want to make sure it's not a UTI, so they do a urine sample. You're in charge of entering the labs and the imaging into the chart. And you kind of remind your provider, hey, you know, they have 6 patients. You kind of remind them, hey, this person's stuff came back. And you work as a team, which is super awesome. And that's what kind of makes it unique. You work one-on-one with them. And you really gain firsthand experience in understanding the process from I met this patient to ultimately diagnosis and treatment. So no prior medical experience is necessary to join as a scribe. We do prefer that you have taken medical terminology or anatomy and physiology, some sort of background in medical terminology. It's recommended, not mandatory, but it would make you a more competitive applicant. The thing about ECC, I think that sets us apart from other scribing companies is the fact that we are relatively small. You know, we're not corporate at all. I know all of my own bosses. Our president, his name, actually, what is his last name's Obitz, but we all call him Topher because his name's Christopher. And like, you know the providers super well. I house sit for some of them. I've babysat for a few of them. Like, you get to know them super, super well, which is awesome. And yeah, so then there's also leadership opportunities available. There is education sessions such as suturing education sessions, ultrasound, case studies, things like that, which is awesome. Right now, those have changed a little bit because of COVID, but we're doing virtual education sessions. We also understand that this is a step in your process to med school. So we have like mock multiple mini interviews, personal statement reviews. When I was applying this cycle, I had a lot of the doctors look over my stuff. And since you guys are students, if you're part-time, that's a 2-year commitment, minimum of 8 shifts per month, like it says. And so that's about 2 shifts per week. And we'll never schedule something that overlaps with your class schedule. You send in your class schedule, and that is ensured to be covered. You will not have a class with your schedule. And what they do also is they send out a draft of the schedule so that you can review it. And if there's a mistake, you can tell them to make sure that you definitely do not have anything with your classes. You work a combination of days, nights, weekends, some holidays, and those just rotate. Overnights are extra pay. If you're on call, that's time and a half. If you are working a holiday, that's also time and a half. Yeah, so I think the thing that sets us apart is just the fact that we are super close. And you have the ease of making shift trades. I know someone texted me today saying, hey, I have class tomorrow at this time. My class time got changed. Can you switch shifts? And I was like, yeah, totally. So you kind of help each other out as scribes, which is awesome. And yeah, we prefer that you're planning a career in healthcare, which obviously all of you are. I think that it really makes you understand the process of how providers interact with patients. And every scribe starts in the ER, but you do have the opportunity after a few months to move into clinics, such as we have OBGYN, toxicology, psychiatric medicine, physical medicine and rehabilitation, cardiology and vascular, and HENT. So you can do those in conjunction with working in the ER. And then we also have the opportunity to do internal medicine inside the hospital, which would be separate from working in the ER. You would only do internal medicine. So there's a wide variety of opportunities, which I think also is a huge advantage. There's yearly pay raises. And I just think as a pre-med, it does give you a lot of experience. I really think personally for me, it did round out my application and made me able to talk about what a physician does specifically better in interviews and stuff. So I know I only have a short time here, so that was kind of my little spiel. Yeah, if you're interested, the best way to apply is through our website. If you have questions, contacting that email is probably the best way to apply. The phone number, I don't think is the best way to apply. These are all the hospitals we have. If you're at the U of M, most of the time you work at Abbott. Some work at United, and then West Health. So it's 2 to 3 locations. Before I wrap up, because I know that you guys have other stuff to get to, does anyone have any questions? You can either unmute yourself or throw them in the chat box. No. Mm-hmm. So we don't give out our direct pay until after the interview, but it is definitely competitive to other scribe companies, 100%. So I would say it's competitive, if not better than most scribe companies. Let's see. Yeah, totally. Does anyone else have any other questions? If not, you can feel free to email. You can actually feel free to email me. I'll put my email in the chat box. Yeah, it is totally okay to apply now to gain experience. Yep, that is, you can, and like I said, you can work part-time. And I think especially working in college is easier as a, sophomore, junior, senior. And 2 shifts a week shouldn't be too hard. If it gets dead on shifts too, you can 100% work on homework. Providers are totally cool with that. So, yep, no, yeah, you can 100% apply now. We are accepting applications. And training, I'll just quickly do that. You have a scribe trainer, you do 10 shifts on the floor with a scribe trainer, just someone who's been a scribe for a long time, and they slowly help you gain your independence on the floor. So, all right. Awesome. Well,
Thank you, Bree.
Yeah, totally. It was nice. I'm glad. Thank you for having me. It was nice to meet you all, and I hope to see some of your applications. Bye, everyone.
Thank you. And we will add Bree's email to the slides tonight too, before they go out so that people can contact her if needed.
Awesome. Okay. Have a great rest of your meeting, guys. Bye.
You too. All right, we are going to jump then into the med student panel. So I'm going to throw these names up super quick and let everybody introduce themselves, but I think it might be helpful to not have the slides on the screen as we chat so we can kind of see who's talking and asking questions. So maybe for introductions, each of the med students can introduce themselves. And I know there were 2 others that might join us that I wasn't 100% sure were coming. So if those 2 people are here, they can introduce themselves as well. But Jamie, you can go ahead if you are here.
Yeah. Hey everyone, I'm Jamie. I'm a first year. I grew up in Minnesota here. I went to high school in Prior Lake, went to undergrad here at the U, and then after undergrad, I took about 5 years off and did some various things before coming back to medical school.
Should I go next?
Yep, sure, go ahead, sorry.
Awesome. I'm Thomas. I'm a 2nd year student at UMN. Let's see. I am also from Minnesota. I was born at Fairview Hospital, actually. I did not do my undergrad at the U of M. I am a pretty non-traditional student. I think I'm like the 3rd oldest student in our class. I went to school a million different places. My undergrad degree was in addiction and mental health therapy, and I was an addiction therapist for about 5 years before going back to school for pre-med. I did most of my pre-med courses at St. Cloud State, but my first degree was at Metro State over in St. Paul. Yeah. Oh, I was also a scribe for a little while. Scribing is fun. I'd recommend it.
Yeah. Hi, everyone. I'm Jose. I'm a 2nd year MD PhD student at the U. I'm originally from Guayama, Puerto Rico, and I did undergrad at the University of Puerto Rico as well. And when I was an undergrad, I did a lot of research and eventually decided that MD PhD was the career that I wanted to have, and ultimately came here to the U of M to do my MD PhD. So that's me.
Is Julia here? Otherwise, I can introduce myself. Okay, we're gonna just skip to me then. So I'm Allie. I am a 4th year medical student at the University of Minnesota, applying to emergency medicine residency. Also a Minnesotan, but I did leave the state for college, went to Northwestern down in Illinois, took 1 gap year where I also worked as a scribe. and then back here for medical school. It's a couple years out since I was in you guys' position of applying to medical school, but I do work with the admissions office. I've worked with them for all 4 years of medical school, and I'm actually one of the interviewers for the MMI for the U. My first interview day is actually next week. So I do have some insight, even though I'm a few years out from applying.
Perfect. Thank you, guys. All right. I think I'm going to stop my screen share then so we can kind of see everybody. And I'll start off with a really common question we had people ask on our Instagram. It sounds like a lot of you guys did take time off between undergrad and med school, and kind of talked about the experience of doing other things. If you did take time off, can you elaborate a little bit more on whether you did that intentionally, knowing you wanted to do medicine, or if you found medicine later on, and what that kind of journey was like in coming back to applying to medical school? Anyone can start. We can kind of just softball questions.
So I actually initially wasn't going to take a gap year. I was going to apply straight through. But I just thought that my application would be stronger with 1 more year of experiences under my belt. I had some science classes I was taking senior year that I wanted to show up on my application. And it is really important to do it once, do it right. And I was just getting really stressed junior year about like trying to figure out, okay, how am I going to balance classes and study for the MCAT and start thinking about this application, and giving myself an extra year just took a lot of stress and weight off my shoulders. And I'm really glad that I decided to take that gap year. It was nice having a year off, and I got to work as a scribe, which I really enjoyed.
So I can go next. So I took a long time off, but my story is a little weirder than most. I had like a much more sort of wandering path through life. So the first time I was in college was 100 years ago, so I'm a person in long-term recovery from addiction. So the first time that I was in college, I mostly majored in doing a lot of drugs, and so I failed out of college actually twice. And then I entered recovery in 2010, and I've been clean since then. And I went back to school after that, which is when I did my undergrad in counseling. And at that time, I was really throughout all my undergrad, I was wrestling with having this really terrible GPA from having failed out a couple of times. But I did not know that I wanted to be a doctor until like 2 years before I applied to med school. I was really happy being a counselor. I worked at a place in South Minneapolis that serves almost exclusively homeless men and trans folk. And we dealt with really difficult populations, and it was very hard for those populations to get adequate medical care. And so at some point I was just complaining to one of my mentors, and he was like, well, you're young, you could do that. Like, go back to school for it. So I took just like an adventure year in a postbac just to see. I hadn't taken a science or math class in 12 years. So I took one, and I liked the way that science made my brain feel. So I really jumped back into that. And then thankfully, the U and a few other schools, they're cool with weird applications. So I know people are really concerned about like, oh my God, my GPA doesn't look exactly right, or I have this little blip. The U specifically loves a weird application. They love a weird story. They love a life experience. Lots of schools are like that. So don't stress too much about it. Having some life experience is great. I think it made me a stronger applicant.
I can go next. So after undergraduate, I was not pre-med in undergrad. I had no idea what I wanted to do, so I kind of floundered around for a while. I was kind of lost. My aunt was like, you should be a nurse. And I was like, that sounds great. So I went to nursing school. And then about a year into nursing school, I realized that wasn't quite what I wanted to do. And then I started talking to professors, and they were like, you should be a doctor. And I was like, you are crazy. Absolutely not. I'm not doing that. Like, that's way too much work. But they got me to shadow somebody, and then I was like, dang it, like, you're right. This is what I want to do. So for lack of a better term, I dropped out of nursing school. And then I did a post-bac, and then after my post-bac, I worked as a scribe for like 3 months before I decided I'd rather do research. So then I ended up doing research for about 2.5 years before starting medical school. And I only applied to the University of Minnesota. I, like Thomas, I have a weird application, like dropping out of nursing school is kind of like brings up questions. But I just knew like this is the only place I wanted to go, and so I only applied here. But I wouldn't suggest it if like you are open to going to other places. I just wanted to stay in Minnesota.
Yeah, and I graduated from undergrad in 2019 and started right afterwards. So
Well, I have a question now. My question is about money and just like how much med school costs and how terrible that sounds. Besides taking out $200,000 of loans, because like I feel like that's what probably most people will do or whatever. Are there like scholarships or ways around that besides going to NYU and being a super genius or something like that? You know, like I don't know. Any ideas, thoughts about that?
Loans. It's all loans. There's some merit scholarships out there, but at the end of the day, you're just sort of committing yourself to loans, which as a fourth year and having now accumulated 4 years of loans, it does make my heart skip a beat a little bit every time they send me my little, here's how much you've racked up. But it's just, that's going to be true of pretty much every medical school, except for, as you say, if you're one of the lucky few who gets the free tuition at NYU.
I think it's always like open to say if you're interested in the military, you can do the military program and get your loans paid for by repaying with your service. Unfortunately, like there are some pretty strict requirements, and if you have certain chronic conditions, you won't be accepted. But that's a way to get free medical education. Well, get it paid for at least.
The other thing I just thought of this, I'd say too, is you can always look for, some scholarships exist outside of what's offered by the medical school. So my hometown hospital actually offers a scholarship, a small one, but a scholarship to health profession students who grew up in that town. And I have gotten that all 4 years. So if you come from like a small town that wants to support their health profession students, or, you know, anything like that. I think some like companies that are healthcare focused maybe have some scholarships you can apply to if you've worked there a certain amount of time. So you might have to get a little creative if you want to get some extra scholarship money, but otherwise it's loans.
Yeah, awesome. Thank you. Or go ahead.
One other thing to add is there's a public service loan forgiveness option. And so during my undergrad and throughout my post-bac in nursing school, I worked as a gymnastics coach for a nonprofit. And so with this program, if you work 10 years, at least part-time in a nonprofit, making regular payments on your loans, they'll forgive the rest of it when you hit 120 payments. That's an option too. So like by the time I get out of medical school, I'll only have 3 years left to pay on my loans before they're forgiven. Hopefully.
yeah. So for those of you that are interested in MD PhD, and this is for most programs, I'm not completely sure if it's all of them in the US. MD PhD, basically they cover your medical school completely. So that's that for those that are interested in a career in being a physician scientist.
One other thing that I'll say, and this is a little bit of a frustrating answer. So I got excited. So I applied super widely. I have no friends or family that are doctors. So I was just stumbling blindly through the application process. And I applied to like 40 schools in my primary application. And then secondaries were super expensive because I didn't know like where I had a chance of getting in and where I didn't. But anyway, so like I put out a whole bunch of primaries, whole bunch of secondaries, and I got interviews at 2 schools, which was U of M and Mayo, and I got accepted to both of those places. And Mayo is essentially free also. But the reason that I chose the U of M was really like money is not a trivial issue, right? I want to like affirm that, but the U is so great. I was like blown away by the culture up here, and I was really underwhelmed at Mayo, and I really had to like reckon with myself about like, all right, is it like worth the money to go to a place that to like be in a place I don't really want to be in, like a program that I'm not as excited about? And I decided after all that I really wanted to be in a program and a city that I was much more excited about. And thankfully, the frustrating part of the answer is that I got awarded a like half tuition scholarship by the U, but they never told me why. So I can't tell you how that happened. You might like try to ask some of the people at, like ask the U of M med school people. We have our own financial aid office. They might be able to give you more information about what qualifies you for that. I just got a letter in the mail that's like, your tuition's half cost. I was like, that's great. I don't have any idea why.
Thank you, guys. Thank you.
I had a question for Allie. You mentioned that you work with admissions, right?
Yes, I do.
So what are some things that make students stand out? What makes people, like the admissions folks, go, that is someone we want working here? Or what are some common mistakes you see on some of the applications and stuff that they put on?
So I would say that answer is going to be different for every school that you talk to. So all of what I say is going to be very specific for the University of Minnesota Twin Cities. That being said, as has been mentioned before, when the U says that they are a holistic medical school, they do mean that. When they say they like people with stories, that's absolutely true. I have so many classmates who have done so many cool things before coming to medical school. In my class alone, we have a former professor, a former dean of a college. We have some former nurses. We have former pharmacists. We have a former flight crew paramedic. I'm forgetting like a ton more really cool experiences people have done. So definitely like, don't be afraid to share that story with the U. I'd say probably the biggest mistake I see people make is not having a story. And when I say story, I don't want to like freak anybody out and be like, oh my gosh, like I did my 4 years of college and I'm trying to go to medical school. Like I don't have a cool, like I did XYZ. I did not have a cool XYZ. I just went to school and volunteered and I want to go to medical school and that was my application. But more of like when you're applying, the whole application is all about proving to the medical, and this is more generally broad advice. This is good for other medical schools too. Your whole application is basically proving to a medical school like, hey, this is why I'm going to be a really good doctor. And so having like in your not just your personal statement saying that story, but also like the descriptions of your activities. So like you have your activity and you explain what it is, and then also talk about like what you learned from it and like how that's going to make you a good physician and how that's going to help you succeed in medical school. And that can include things that like aren't medical focused. Like the summer after my freshman year, I had a marketing research internship because I needed a job and it was open. So there we go. That was my qualification for that one. And I hated it. I am not an office job person, as you could probably guess by the fact that I'm going into emergency medicine. I need to be moving and doing things and talking to people. And I made that part of my application. In the description of the job, I talked about how even though it was a great job, like I realized like corporate isn't for me. That's not what I want to do. And so it's sort of all of it just contributes to like, here I am, here's why medicine. I hope that was helpful.
I know we're missing one person, Julia, who I believe was supposed to represent like the third year medical student, but would you kind of each be able to explain what your class load and your school year this year looks like? And then, and Jose, you can go a little bit more in depth on what the MD PhD program looks like as well. And then maybe Allie, you can dive a little bit into MS3 and MS4 if you guys don't mind.
Should we just start at the beginning with me? Cool. So I'm a first year and I was trying to figure out a good way to think about like what first year is like. And it's like it's all your hard sciences. So you have like one big class called SMP and it's all like your biochemistry, your genetics, your cell biology. It's all like lumped into one giant class. And you could have like a biology lecture in a day and then like the next day is genetics and the next day is biochemistry, and it's just kind of sporadic. And so that class takes probably the most time. We have about 8 lectures a week in that class. And then we have histology, which is just like a 4-credit class. That one's probably the lightest class of the bunch. And then, of course, there's anatomy and embryology, which, depending on your background in anatomy and embryology, can be a lot of work or it can be a little bit of work. I was a kinesiology major in undergrad, so the first half of the semester doing bones, ligaments, tendons, that was pretty easy for me. And we just started like abdomen this week, and I'm like, oh my gosh, like what is going on? So you guys are smiling like because you relate to it. I hear it gets better after first semester, but I definitely like you have to make time for your non-negotiables, and that's something somebody told me during orientation week, and I was like, oh my gosh, like I'm just going to study all the time, but you will go crazy. So I put things in my calendar. I'm like, I'm going to go to coffee with a friend this day, or I'm going to go to game night with my family this night. And I just make sure like whatever I do, I get my priorities done before that. And if I have extra stuff to do, I'll do it some other time, but you just have to take time for yourself.
Yeah, I definitely agree with what Jamie said about taking time for yourself. That's very important in medical school or in any profession that you guys eventually choose. It's a long path, and it can be very intense. So taking time for yourself is essential to not get burnt out. In terms of me, I'm a second-year medical student, and in second year, basically we work in blocks, which is a shift from what is first year, which is based in semesters. And in our second year, we basically work in the different organ systems, and we talk about or learn about, I guess, everything that can go wrong with them. For me, as an MD PhD, the summer before M1 and the summer between M1 and M2, I spent it doing research and rotating through labs to identify what lab I wanted to join for my PhD. And now this semester, because we're in blocks, I'm basically checking out what are the different PhD programs out there, deciding what PhD program I want to join, reading articles that's not the main focus of what I do. I mostly study for M2 because it's a lot. But if I have some time, I also read articles about prostate cancer, which is the lab, which is what the focus of the lab that I'm joining is, and try to identify what specific thing I want to research while I'm doing my PhD. I know I mentioned earlier that the MD PhD program covers for the cost of medical school. They do that also for the PhD, and they provide you with a stipend and a 95%. They cover like 95% of your health insurance. So that's those are some of the perks of being 4 or 5 more years here at the U. However, I also want to make the disclaimer that for those of you that are thinking about that, make sure that you also want that PhD. You know, earning a PhD is not easy at all, and eventually you will be losing 4 or 5 years of money as a physician. So although upfront it may seem like you're making money out of studying, eventually you may be losing some money on the long run. So that's my spiel for MD PhD.
I'll just add a couple of things. So yeah, I mean, Jose is just doing a whole thing on top of what I'm doing, and so he's busier. But yeah, so second year, like Jose said, we don't do like semesters anymore. Now we do like little blocks that are about 6 weeks each that all focus on 2 or 3 different organ systems. So our first block was lungs and heart, and right now we're in heme and GI. There were a couple questions in the chat that I just wanted to address super quickly. So the basic science courses, they do go over basic things again. So you don't have to remember 100% of things from undergrad, but they go through them really quickly. So for instance, like biochemistry was probably like the undergrad course that I took that was the hardest or that the most people failed. And we went through the entire year's worth of biochem content in 3 days in the med school course. So you just like, it's a lot. So you can't bank on like not paying that much attention in undergrad and just like learning it over again, but they will address it. So if you don't have a strong background in it, you don't have to worry about that. And then the classes you take each semester, in first year, you take about 3 big classes every semester. And then there are a couple real small classes that you stay in throughout all of first and second year. And so those are sort of like your being a doctor classes, right? So in first year, you have things like Jamie said, your anatomy and histology and SMP, and then in the next semester you have like microbiology and neurology and physiology, and then summer has similarly like 3 big courses. But then you also have these 2 things that are like talking through cases and learning how we make a differential diagnosis and how to write notes and how to do a physical exam. And those are not negligible classes, they're just fun. Right? And so you do have to study for them and spend time on them, but not in the same way that you do those like 3 big classes. And then in second year, you essentially only have 1 big class in addition to those 2 kind of fun things, right? So we have like our systems class in every block. Oh, so I'm not in third year, but we're getting like bombarded with presentations about what third year will be like. So if you'd like, I can tell you what I know of what third year will be like. Otherwise, you can talk about it, Allie, if you...
I either way is fine. I have done both third year and half of my fourth year.
Okay.
So third and fourth year are your clinical rotations. So first and second year are preclinical knowledge. Third and fourth year is clinical knowledge. And so that's when you start doing rotations in the hospital. You don't really have any in-person, well, nobody has in-person stuff with COVID right now, but you don't have a lot of like in-person lectures. There's like every rotation has like didactic time, which is like a half day a week of lectures. And then the rest of it is just working as part of the team in the hospitals or in the clinics if you're on an outpatient rotation. So there are core rotations that every student is required to do. So that's like family medicine, surgery, medicine, psych, neuro, OB-GYN, emergency medicine, ICU. Yeah, I think those are the cores. So third year is mostly doing your core rotations, and then there is some elective time in there as well where you can do other rotations that you find interesting. And then fourth year is basically the summer of fourth year is you trying to get all of your advanced rotations in so that you can get your letters of rec and make your ERAS residency application look all beautiful and perfect. And then once you submit that, the rest of fourth year is just doing elective rotations. So yeah, I personally, third and fourth year have been my favorite years of medical school. I think it's so fun getting to be in the hospitals, working with the physicians. Rotations are like, depending on where you are and who you're working with, you can get a very different experience. But I've been pretty fortunate to have really great attendings who like teaching and like having me take initiative to do things myself. So I've been very fortunate to feel like I am genuinely part of the team, which is a lot of fun.
There was a question, in the chat, and then I know a couple people were also submitting online questions about this. In your guys' experience, is studying for med school a lot of like at-home grinding and watching lectures, or is there like practice assignments and stuff like that you do? And also, I know a lot of us undergrads are experiencing video lectures for the first time. In med school, do you have in-person lectures most of the time? I've heard some med students talk about just sitting at home watching most lectures online. What are your guys' experiences with the learning platform, I guess?
Yeah, so there are very few assignments like I would think of in undergrad, right? There's not a lot of like, fill out this worksheet or like do these sort of like things out of a book. It's just really not how it works. It's a lot more, if we have any assignments at all, well, no, I'd say that we do some like quizzes and things to make sure that you're on track with your understanding, but there's very, very few assignments. There's some like projects that you're working on with little groups, right? So for those sort of fun classes where you're learning about like how to do physical exams and how to do how to like take a history, you'll, there are a couple assignments where you like write up a note or a differential diagnosis or something like that and submit that. But those are real low stress, especially for the people who scribed, because you've done it many, many times. So yeah, they're not that difficult. What was the other part of that question? Oh, about lectures. That's right. So it's obviously changed a little bit now. Have you guys done anything in person, Jamie, other than anatomy?
We had ECM in person.
Okay.
Though.
Yeah. So obviously right now it's all just recorded and very, very little is in person. However, in first year, almost all of the lectures are optional. You don't actually have to show up to lectures ever. Or even watch them if you want to learn the content in a different way. You just have to get the content down. The U specifically is very much, they want you to learn however you learn best. So if that's reading out of a textbook, if that's like learning from third-party sources, if that's going to lecture, if it's watching, almost all lectures are recorded and you can play them later at your convenience and you can play them faster, which is helpful for me. So yeah. It's really a lot of first year is figuring out like what strategy works best for you, and what worked best for me in undergrad was going to class. That did not work in my first year. So I had to like readapt and figure out how to learn things differently. So first year is a lot about like trying to figure out what works best for you as far as how to pull in the content.
If anyone else too has specific questions, you can feel free to unmute yourself or continue sending them in the chat.
One thing I learned a lot, kind of going back to that studying thing, is like I'm telling my family, like I'm always studying, and they're like, "Oh, do you have a test coming up?" I'm like, "No, you just have to study all the time." Like I don't know how to explain it to them. But one thing that I had to like change coming from undergrad and nursing school, and even my post-bac, was that I can't study for anatomy the same way that I study for our SMP class, and that was really hard for me because I always did the same thing. And it really took me like 2 to 3 weeks, the first 2 to 3 weeks of the semester, like figure out how I was going to study for each class. And now that we've just passed midterms, I'm trying to figure out how I'm going to do anatomy now that it's not as easy as it was for me at the beginning. So it's a constant like moving of how you're going to do your studying. But the school offers a lot of resources. Your like second, third, and fourth years are like great resources to give you like insights to what they did. They've got a learner development office here, and like we had a really tough first exam, and I ended up meeting with Dr. Slattery, and he was like, "Oh, like maybe next time try this technique and this technique," and then he ended up like following up with me to see how it went on the following exam. So there's a lot of support, but it's a different type of studying than you're probably used to from undergrad.
I had a question. So I know most of you are non-POC, I'm assuming, from what I can see, but have you heard anything about the program and how it is for people of color, how the curriculum is? Because a lot of the curriculums I've seen are very white and focus more on white patients, and there's a lot of racial medicine that happens. But I heard recently there was a whole movement that all the med school students did a thing where they pressured the dean to update the curriculum. So could you talk a little more about that?
My class and the third year class love writing letters. We have done a lot of like, here's a group letter signed by our class. These are the changes we would like to see in our medical school. So you're right. A lot of, and this is not, the U is guilty of this, and so are many other medical schools. A lot of medical education is centered on, a lot of medicine in general. What we know about medicine comes from our studies that have been done on white males. You know, and so there's a lot of groups that have been traditionally left out of medicine. And while steps have definitely been taken to try to introduce more diversity into both our our student population and also in the curriculum we're learning, I think definitely there's still a ways to go and changes that can be made. Some examples of things that they have done that I think are really good in our like derm block that you guys get December of second year. December? Does that sound right? Second years, maybe. We have this really fantastic dermatologist who comes in and gives a lecture specifically about like dermatological conditions in skin of color, which I think is great. And then your third and fourth year, you kind of like get your own like curriculum ahead and working with diverse populations, because that's who you'll be seeing in the hospitals when you're working. So because there's not really like formal curriculum third and fourth year, it's sort of like you go to the hospitals and the patients you see are the patients who teach you. But yeah, I'm a little removed from first and second year, so I don't know if people who are actually in there want to speak towards what it looks like.
Yeah, well, one thing that I'll say is that the administration, so one of the biggest changes I thought between my undergrad education and here was how receptive the administration is, and how much they really see you as peers and colleagues and will pivot based on what you want to see, right? So in all of our classes, like they got to teach to step one to some degree, right? So there's like content they really got to get. But if you like leave reviews being like, whoa, this section is like, wait, like, oh, there was this racialized medicine thing put in, like, what the hell was that about, right? Like they will pivot and they will respond to that immediately. That just happened in one of our classes a couple days ago, right? Where the lecturer was like, oh yeah, well, donor, like Black donors as opposed to white donors, and isn't that a thing? And then like during the class, we all were like, hold up, this conflicts with our understanding of like race as essentially a biological myth. And like and they pivoted on it immediately, right? And like sent out a class-wide email being like, we have to do better at this. We're going to reform this class in order to address this concern that you guys had. And of course, after the uprisings this summer, I was really surprised. So my sister is part of the Black activist community in the cities and raised this concern that frontline protesters didn't have access to COVID testing. So we were like, well, I wonder if the med school can do something about that. And I asked one of our professors, and his advice was to go directly to the dean, which I thought wouldn't get anything done, but our class composed a letter, sent it to the dean, and he got testing done within 2 weeks launched a mobile testing program. They really want to change in the ways that they see students want to see change. And so over this past summer and the beginning of this fall semester, there's been this huge emphasis that is mostly generated by the students, saying like, we want more emphasis on social determinants of health, and we want to see how race is impacting our race and racism and white supremacy, both in our area and nationwide, is really impacting our patients' health. And so they're turning, right? Like they have to write whole new curricula, and so it takes a little bit of time for sure, but they certainly are receptive. We just got to keep pushing is the thing. Of course, like, it's not perfect and it's not gonna be. We gotta keep pushing, right? But I've been impressed by like their being receptive toward that feedback and really making changes.
I know one thing I can add to that is the school has done a big change even from Thomas's time in first year to my time, as we've had in our Essentials of Clinical Medicine course, we have every Wednesday morning we meet for 4 hours and we talk about things like that you need to know as a doctor, like how does insurance work? And our first 4 or 5 weeks of the class is all about race-based medicine and getting rid of racism or combating racism in medicine. And they've given us a lot of resources of like dermatology resources of how to recognize different pathologies on different skin tones, which has been really helpful. And like Tom said, to echo that, they've been really receptive to changing wording. And even in our hard sciences course, they talked about like the inheritance. They were like, oh, like 50 or 25% of this race carries this, or is a carrier for this thing. And our class was like, hey, like, wait, like that's not cool. Like, is it race or is it like an ethnicity thing? And then they kind of like backtracked and they apologized to the class and they changed it in the slides. And so they're trying. The school is really open to feedback and they want the students to point out like where they see issues. I pointed out the other day in the class, this isn't related to race, but on one of our exam questions, they referred to a homeless man and not a man experiencing homelessness. And that's something that like how you talk about your patients like kind of sets a stigma for them. And so I emailed the professors and I was like, hey, like, I understand the point of this question, but like maybe it should be rephrased to this so students are reading like a person experiencing homelessness is not a homeless person. They're experiencing homelessness and they're not homeless. And it's just like kind of how we think. And the professors were like, oh yeah, I'm so sorry. Like we'll change that going forward. So they're really open. And that's something I really like about the U here.
Yeah, I agree 100%. They're really open to improving year after year after year. And we have seen those changes going from the classes that were above us to our class and now to Jamie's class. In addition to that, we have had sessions in which we discuss race and racism in medicine. And I consider those sessions very important because if you don't recognize racism, there's no way to stop those racist acts from occurring. So all of those that spoke before me talked really well, and I just want to add that to what they said.
Also, just to the follow-up question that was put in the chat, I'm speaking entirely from a place of privilege, so I can't really say whether the environment is toxic or unhealthy for students of color. I think that my classmates and friends of color have noted frustration just like living in a white supremacist society, right? Like that's the reality. And so certainly there are lots of difficulties that I don't experience as a white dude, right? So yeah, I think if you want to be connected to some of the med students of color, we have a very active White Coats for Black Lives, and there's also LMSA, which is let's see if I can remember the acronym, Latino Medical Students Association, LMSA.
Yeah, I'm actually the vice president for LMSA. Yeah, so it's the Latino Medical Student Association, and you can email me even or message us through Instagram or Twitter. So.
Yeah, and then there's the is it AMSA, the Asian
Pacific Medical Student Association? Yep.
Yeah, is also really active. There's is outside of race, but there's Pride in Healthcare. Is like the Queer Medical Students Association. There are actually a couple of them. I'm a member of both of those, and then. Yeah, so there's lots of like active student organizations. So if you want experience, if you want to hear from students who have the specific, who have that, who are people of color, who are medical students, then they would be great people to contact.
Thanks.
I know we only have a couple minutes left, but I did see Sarah popped in a pretty common question as well. And if you guys each want to give your quick elevator pitch on maybe how you sought out medical schools that you felt you fit the mission of. I know you guys kind of mentioned you definitely had a range of tactics on how you did so.
Yeah, I'd recommend having more direction than I did. I wasted a lot of money. So somebody wrote in MSAR. That's a thing that I didn't know existed until I put in my primary application. But that's very good information to have, right? Because there are some schools that I just didn't have a chance to get into, not because my scores or whatever weren't good enough, but just because they essentially only take in-state people or people with a relationship to that school or that state. And I didn't know that. So all I knew when I was applying was like, I'm an urban kid. I really Googled like, what are the biggest cities in the US? And just applied to med schools in all the biggest cities in the US. And just like, what are places that I would like to live in and all that sort of stuff. That was really like my criteria. And so I was lucky to get the interviews that I did, but yes, I wasted a lot of money. And I talked a little bit already about like what my choosing between the two programs that I got accepted to, but I was advised by lots of doctors that people don't transfer medical schools, right? So you really want to be choosy about like, I want to both like the program and I want to be able to live wherever I got to move to, right? Those are big deals. And I couldn't see myself living in Rochester. Sorry about it if some people are from Rochester. It was not for me.
Yeah, I said it earlier, I only applied to one medical school, or I guess two. I applied to Duluth and Twin Cities. For me, it was a lot of like, I knew I was going to need some support while I was in medical school for my family, and I wanted to be close to my family. I was also, at the time of applying to school, I was a caretaker for my grandmother, and so that was something I just wanted to be around for, as long as she was with us. And so I decided only to apply to the University of Minnesota medical schools. I did write that in my application. There's like one of the questions that they asked was like, anything you want the school to know, like just general, whatever you want. And I was like, I love Minnesota. I only applied here. Like my support system's here. And I just like, I want to live here. I want to raise my family here, and which is all true things. But I just really wanted to convince them that, and let them know that this was my only option, and that I was kind of like putting all my eggs in one basket. And thankfully it worked out. I guess I don't know what I would have done if it didn't work out. But that being said, I hear from a lot of other people, MSAR is the way to go.
I had to think really hard to remember back to applying to medical school, because that was 2016 for me. So it's been a bit. But MSAR, that's where I started. Start with like your stats, and then if you have any like geographic preferences, and then sort of research from there. I think looking at schools' missions is important, and look at like who you are as an applicant. So if you're more non-traditional, or like for me, I wasn't a science major. I took the minimum number of science classes to call myself a pre-mid, and then noped out to my liberal arts degree. So for me, like I use like the letter of rec requirements to figure out whether someone would like value my liberal arts education. So like if they say like 2 science letters of recommendations, I was like, ooh, I can get 1 max. So off my list. And then yeah, location is a big one, because wherever you go to medical school, you're going to be there for 4 years. So you better not totally hate it. And Minnesotans should apply to Minnesota, because we have a really great in-state bias towards Minnesotans. So you should take advantage of that.
Yeah, so for MD PhD, when I was applying, I applied basically all over the country. When it comes to MD PhD, you really want to start off by looking what places have the research that you want to do, because in the end, medical school will be very similar wherever you go. So the research is the very important and variant in where you go and where you decide to do your MD PhD. So that's a very important component. MSAR is also of great help, and I used it a lot when researching what places I want to apply to, and even like noticing that certain places had MD PhD programs that I did not know of. Another important thing when deciding where to go for your MD PhD is basically the funding that you will receive and where you will be living. Because I heard a couple of you saying that you want to be in a place that you would want to live for 4 years. MD PhDs do that for 8 or 9. So that's even more important for those that are applying MD PhD. In terms of funding, if there's programs out there that offer full funding, like the one at the U, you obviously want to go to that program. Typically, the programs that have the name Medical Scientist Training Program, those are the programs funded by NIH, and those are fully funded. The U is an MSCP. However, there's also non-MSCP MD PhD programs that also offer full funding. So those are also good ones to check out.
I want to be sure to respect everybody's time, including the med students who joined us. So if anybody has any questions beyond what we discussed today, I know some of these students offered to provide their email, as well as I did have some other students who emailed when they submitted their interest form that offered to answer questions as well. So I will be sure to provide that information in the follow-up email tomorrow. But I do want to say a huge thank you to you for joining us and being willing to answer these questions and donate an hour of your very busy schedule. So thank you very much. All the general members, if you guys have any questions about AMSA specific things, the board is going to be here for a little while.